Don't ignore these 15 silent symptoms. After age 60, your life may depend on it. As we age, our bodies become more vulnerable to illness. But what makes it even more dangerous is how subtle some of the warning signs can be. Many serious health conditions start with silent, seemingly harmless symptoms. Unfortunately, these often get brushed off as just part of getting older, but doing that can be a deadly mistake. Today, we're going to walk through 15 silent symptoms that you should never ignore after the age of 60. Whether you're in your 60s or caring for someone who is, being aware of these early red flags could save a life. Unexplained weight loss. Losing weight without trying might sound like a good thing, but it can actually signal serious issues like cancer, thyroid disorders, or digestive diseases. If you've dropped more than 5% of your body weight in less than 6 months without changing your diet or activity level, it's time to see a doctor. Shortness of breath. Feeling winded after climbing stairs, walking short distances, or even at rest can be a sign of heart disease or lung problems like COPD or pulmonary embolism. Many older adults chalk it up to just aging, but it should never be ignored. Persistent fatigue. Constant tiredness that doesn't improve with rest may signal anything from anemia to heart failure or even depression. If you feel like you're always drained, no matter how much you sleep, it's worth investigating. Difficulty swallowing. Occasional trouble swallowing is common with age, but if it's persistent or getting worse, it may point to a neurological disorder or even esophageal cancer. Difficulty swallowing can also increase the risk of choking or aspiration pneumonia. Sudden confusion or memory loss. Mental fog, confusion, or sudden memory problems may be signs of a stroke, infection, like a urinary tract infection, or early dementia. Any sudden changes in mental clarity should be treated as a medical emergency. Changes in bowel habits. If you're noticing constipation, diarrhea, or changes in stool color or shape that last more than a few days, don't brush it off. These can be early signs of colon cancer or gastrointestinal disorders. Numbness or tingling. Tingling sensation or numbness in the limbs can signal nerve damage, diabetes, or even an early warning sign of a stroke, especially if it's one-sided or comes on suddenly. Chest discomfort. Chest pain isn't always a crushing pressure. It can feel like burning, aching, or tightness, especially in women. Don't wait to see if it passes. Seek immediate help. It could be a heart attack. Frequent falls or balance. Falls are the leading cause of injury and death in seniors. If you're feeling more unsteady, dizzy, or have fallen recently, it might be due to inner ear issues, medication side effects, or neurological disorders like Parkinson's. 10. Skin changes. Moles that change shape, grow, or bleed could be a sign of skin cancer. Also, unexplained bruising or new skin lesions should be evaluated, especially if they appear suddenly or without clear cause. Persistent cough or hoarseness. A cough that won't go away after a few weeks, especially if it's dry or causes hoarseness, can be a sign of lung disease or even throat cancer. Don't assume it's just a leftover cold. trouble urinating or blood in urine, changes in urination patterns, like difficulty starting, increased urgency, or blood in the urine, can indicate prostate issues, bladder infections, or kidney disease. These symptoms should be checked promptly. Blurry or double vision changes can point to cataracts, glaucoma, or even diabetes-related eye damage. Sudden double vision or partial loss of sight could also be signs of a stroke. Depression or social withdrawal depression in seniors often goes unrecognized. If you or a loved one is losing interest in hobbies, avoiding social contact, or sleeping excessively, it may be more than just getting older. 15. Slow healing wounds if cuts. Scrapes or sores are taking unusually long to heal. This can signal diabetes or circulation problems. Poor wound healing increases the risk of infection and should be taken seriously. Making health a priority after 60 doesn't mean living in fear. It means staying informed and empowered. Recognizing early signs, no matter how minor they seem, allows for faster diagnosis, more effective treatment, and often a better quality of life. Let's now explore how to respond to these symptoms, practical prevention steps, and what you can do right now to take control of your health. Understanding what silent really means. When we refer to these as silent symptoms, it means they're often subtle, easy to miss or misinterpreted as benign or age-related. Unlike sudden chest pain or fainting, these symptoms creep in quietly, sometimes over weeks or months. For example, fatigue might be blamed on poor sleep, or shortness of breath on being out of shape. But these can be the first clues of underlying diseases that only grow worse over time if left unchecked. That's why it's important not just to notice these symptoms, but to track them. Keep a health journal. Document when a symptom begins, how often it occurs, what triggers it, and any other accompanying changes. Bring this journal to doctor visits. It can be an incredibly helpful tool for accurate diagnosis. How to approach your doctor. Many older adults hesitate to bring up certain issues during checkups, either out of embarrassment, fear, or the belief that it's probably nothing. But you should never feel like you're wasting your doctor's time. A symptom that seems small to you might be a critical warning sign from a medical perspective. When visiting your healthcare provider, be specific. Instead of saying, "I feel off," try, "For the past 3 weeks, I've been feeling unusually tired even after sleeping well. I also noticed I'm short of breath when walking to the mailbox, which didn't happen before." Bringing up more than one symptom is also important. Doctors are trained to look for patterns. Fatigue combined with weight loss and difficulty. Swallowing tells a very different story than fatigue alone. The role of routine. Screenings. One of the most powerful defenses against silent symptoms turning deadly is regular screening. Depending on your medical history, gender, and current health, your doctor may recommend colonoscopy or stool tests for colorectal cancer mammograms, or prostate exams, bone density scans for osteoporosis vision, and hearing tests blood work to check cholesterol, blood sugar, thyroid function, and kidney health EKGs or stress tests to assess heart function. These screenings often reveal problems before symptoms appear or in the early stages when treatment is most effective. Lifestyle shifts that help prevent. Silent symptoms. While not all illnesses are preventable, many of the most common chronic diseases that cause these symptoms are strongly influenced by lifestyle. Here are 5 core areas to focus on after 60.1. Nutrition. Eat a diet rich in fruits, vegetables, lean proteins, healthy fats, and whole grains. Reduce processed foods, sodium, and added sugars. Staying hydrated also becomes more important with age, as thirst signals weaken. Physical activity. Exercise isn't just for the young. Seniors who remain active have better cardiovascular health, cognitive function, and mobility. Aim for at least 150 minutes of moderate intensity activity each week, such as walking, swimming, or Tai Chi. 3. Sleep hygiene. Poor sleep can mimic or worsen symptoms like fatigue, depression, and memory issues. Stick to a regular sleep schedule, avoid screens before bed, and address underlying sleep disorders like sleep apnea with a professional. 8. Mental wellness. Stay socially connected. Isolation and loneliness significantly increase the risk of depression and even physical health decline. Join a group, attend a class, volunteer, find reasons to stay engaged. Medication management. As the number of prescriptions increases, so does the risk of drug interactions or side effects that may mimic or mask symptoms. Regularly review your medications with a pharmacist or physician and never adjust dosages without guidance. Watch for patterns, not just problems. Sometimes a symptom doesn't show up alone. It's the combination of subtle signs that paints a clearer picture. For example, mild memory loss, plus fatigue, plus urinary changes could signal diabetes confusion, plus dizziness. Plus trouble walking could point to a stroke or brain issue coughing. Plus weight loss. Plus hoarseness could suggest lung disease. Pay attention to how symptoms interact and evolve. If they're getting worse, happening more frequently, or beginning to interfere with your daily life, it's time to act. Take care, not chances. It's easy to downplay things when you're feeling mostly okay. But ignoring silent symptoms is like ignoring a slowly leaking pipe. Eventually, it bursts. Health issues that start small often become harder to treat as time goes on. You don't need to panic about every ache or change, but you do need to listen to your body. Be honest with your healthcare team and take action early. Living past 60 can be vibrant, active, and fulfilling, but it also comes with responsibility. Your health doesn't just affect you, it impacts your loved ones, your independence, and your ability to enjoy the years ahead. So check in with your body regularly, ask the hard questions, and never be afraid to follow up on something that doesn't feel right. The most dangerous symptom is the one you ignore. And remember, it's not just about adding years to your life, but life to your years. Let this be your reminder. Don't wait. Be proactive. Your life may very well depend on it. Final thoughts: aging doesn't mean you should accept every ache, pain, or change as normal. Many silent symptoms are your body's quiet cry for help. listening to those signals and acting on them can mean the difference between early intervention and a serious, even fatal, condition. If you or a loved one are experiencing any of these symptoms, don't delay. Consult a healthcare provider and take proactive steps toward better health. After 60, prevention and early detection are your most powerful allies. Your life may very well depend on it.